How are you?
Fine.
Are you making a lot of money? You must be. That's the only way you would be here. Right? Okay. So, today we're going to find out a little bit about the American healthcare system. Okay? This is not a full explanation. I know you won't believe that when you see how long the presentation is. However, believe me, it's just an introduction. These things are complicated, okay? So I've tried to make it as simple as possible for you to understand, okay? So, here we go. The American healthcare system. All right, so we need a little bit of vocabulary to understand what is happening here, okay? So, the first word is premium. Okay, your premium is what you pay every month. Very similar to your rent. Okay? Your deductible. Okay, your deductible is how much you have to pay before your insurance will pay. This is a variable amount. It changes depending on how much your premium is. But we won't worry about that. Okay? The important thing to know is that your deductible is valid for a calendar year from January to December. So, if you, let's say, were to get sick in December and your deductible, let's say, was $5,000, you would pay $5,000. If you had to be in the hospital still in January, you would have to pay $5,000 again because your deductible would be due again. Fun, right? Okay. And then the other part is the co-insurance payment or the copay. Okay? So depending on your insurance, you have a copay, no matter what. Okay? So some things are covered 100% by your insurance. Most things are not. And you have to pay a portion, and your insurance pays a portion. That is a copay. Do you understand? Yes. Are you ready to have fun? All right. So, the first question is, does the United States have a public health care service? How many people think we do? How many people think we don't? How many people think we do and they think it's Obamacare? Okay, well, we do have a public system. It is called Medicare and Medicaid. Okay? Now, this is a limited public system. Okay? So, Medicare and Medicaid, you will see Medicare, the word care, we normally take care of old people. Okay? And that's who Medicare is for. Medicaid, aid to help people, okay, is for poor people. Okay? In general. Some people qualify for both. Lucky them, right? The rest of us mortals have to pay for a private insurance. Okay? Normally you get this insurance through your work. However, you have to be a full-time worker. In other words, you have to work more than 35 hours per week to get that benefit from your employer. And that assumes that your employer will give it to you. So let's find out about Medicare and Medicaid, because I know all of you in here love public health care service. So, here we go. All right, so here we are. We have 50 million people in 2010 were enrolled or signed up for Medicare. You had 66 million people signed up for Medicaid. All right, and some 10 million people were eligible for both. Okay, so that means we had 116 million people on our public health care service. How many people are in the United States? A lot, right? So there are a little more than 300 million. In other words, 1/3 of these people have a subsidized public health care. Okay? Did you think it would be that many? No, because you didn't even know we had a public health care system. Okay? And to be honest, there are some Americans who don't even know we have this. Okay? All right, so this is the general overview of Medicare and Medicaid. Okay, so Medicare is a federal insurance program. Okay, it is all over the country. It benefits people who are over the age of 65. Okay, participants, here's the important part, pay deductibles and pay part of coverage, so it's not complete. Okay, and it's divided into 4 parts, A, B, C, and D. So it's nice and simple. Okay, I'm going to explain those things to you. Medicaid on the right, okay, is paid for by federal, state, and local taxes. Okay. Now, Medicare is for our country. Okay, there is one set of rules for everyone. Medicaid has some rules, but states are able to change the program to pay for the things they want, to offer the services. We will talk about those services later, okay? It, of course, benefits people with low incomes. We'll talk about what it means to have a low income, okay? Participants pay very little or no part of coverage. In other words, this is basically free, essentially, okay? So, what you see in the middle, people with disabilities, prescription drugs, okay, these kinds of things, are for both, okay? So, we'll start with Medicare, okay? All right, so what is Medicare? Well, essentially, Medicare is an insurance for old people. Okay? Once you become 65, 65 is the age you can retire. Okay? You qualify to sign up for Medicare. All right? There is an exception to this if you are under the age of 65 and you have certain disabilities, you can qualify for Medicare. Okay? And these people with disabilities will qualify for both Medicare and Medicaid. Okay. So, to give you an example, my grandfather has Alzheimer's disease. Okay, so he has both Medicare and Medicaid. Okay. The Medicaid helps pay for his stay in an assisted living facility. Okay. Now, while he's there, he gets care, and what he has to pay is subsidized by Medicaid. To give you an idea, the bill every month for my grandfather, where he lives, is a little more than $3,000 per month. How much does Medicaid pay? A little more than $1,000 a month. So that means he has to have $2,000 more or less every month to pay. But guess what? You don't qualify for Medicaid if you have more than $2,000 in your bank account. Ha-ha! Look at that. All right, so you see, the fun is just beginning. All right, so I told you that Medicare is divided into 4 parts. Part A, Part B, Part C, and Part D. Now, you think that sounds easy because it's the ABCs. Wrong, okay? It gets a little complicated. So, Part A. Part A is the part everybody qualifies for if you have worked 10 quarters, okay, in the United States. You qualify for this, right? And you see it takes care of inpatient hospital, skilled nursing facilities, and some health visits and hospice care. Do you know what hospice care is? Hospice care is when you have a disease that is going to kill you, and you do not want to stay in the hospital. So you go home, they give you pain medication, and you die there. Lovely, right? Okay. But actually, hospice care is quite important. And people are becoming sicker and sicker every day with things like cancer, mental disease, and things like that. Okay? And they choose to not die in a hospital. So it actually is a good thing. Okay? Now, how do we pay for this? Well, you see here, it is funded with almost 3% of what you make. Okay, so when you work in the United States, you will see that there is a deduction from your salary. Okay? Part of it is paid by your employer, the other part is paid for you. Okay? Not quite like the Spanish system, right? Where the worker doesn't pay a whole lot. The worker pays about 6%, Social Security, 7%, right? And the employer pays some 32, 33%. Okay? Now, for working hard and making more money, you pay more. Okay? You pay another 0.9% if you make over $200,000 per year. Okay, so you pay more into it. The fun part is, even though you pay more into it, there is a cap, a maximum amount that you can receive. So people who make that money will always pay more money into the system than they will ever receive. Okay, that's part of the deal. So, in this case, about 55 million people are enrolled or signed up in Part A. All right, so how much does it cost? I don't know if you can see this. I hope you can. Okay, so the first number is the deductible. Do you remember what the deductible is? The deductible is the amount you have to pay before the insurance will pay. In this case, your insurance is Medicare. Okay? So, if you get sick, you have to pay $1,260 before Medicare will begin paying your bills. Okay? Now, here's the fun part. Let's suppose you have an accident, a serious accident, and you have to be in the hospital for 6 months. I know, it sounds terrible, right? But it can happen, all right? So, if you stay in the hospital, the first 60 days, or the first 2 months, are covered completely by Medicare. If you stay longer than 2 months, you have to pay $315 every day you stay in the hospital after that. Start doing the math. Now, you get 1 more month. After the 3rd month, the price goes up, and it is $630 per day. Now, you get a limit, 150 days. If you have to be in the hospital longer than that, guess what happens? You don't have Medicare anymore. Okay? All of that, any bill, any costs, any expenses after that have to be paid by you. This is how people go bankrupt. Okay? As you've heard all those stories, this is why it happens. Okay? All right. You have a list of other things. I'm not going to talk about all of them because they're not as important. This is the main idea. So, what you can understand from this is that your Part A of Medicare is not enough. Okay? Plus, it only takes care of your hospital bills. It doesn't take care of your medications or anything like that. Okay? And here's where the other parts will be important. Okay? So Part B, this normally goes hand in hand with Part A. Okay? So Part B, this helps pay for your physicians, your outpatient, some health and preventative services. Okay? Preventative care is very important now. It is an important part of Obamacare, which I will talk about later. Okay? So, Part Part B benefits also include ambulance services, if you need wheelchairs or oxygen to breathe, kidney supplies if you have bad kidneys, things like that. If you need an X-ray or a magnetic resonance imaging, okay, that's an MRI in American English. In British English, it is a scan. Okay? So all of those things are covered, at least in part, by Part B. Okay? And here's where Part B is funded by general revenues. General revenues means taxes. Okay? And it's beneficiary premiums. That means those are the premiums you pay. Do you remember what a premium is?